Welcome to Self-Taught, where former foster youth, like myself, share our real-life experiences with sex, health, and life. Hosted by the Reproductive Health Equity Project, these are some conversations we wish we'd had earlier.
Hi, everyone. Thank you so much for joining us today. My name's Tamar, and I am a Youth Advisory Board member, also known as YAB, and I am here with two fellow YAB members, Phillisha and Brandy, and we're also very thankful to have Alex Morse here, who is a Planned Parenthood Community Educator, and we're going to talk about all things regarding accessing an abortion in the state of California, how to empower yourself, what does an abortion look like, and how can you find resources. Keep in mind that some of these topics are going to be triggering, so feel free to listen as you please. And thank you so much for listeners being here to join in on this conversation. So I would love to start things off by getting the facts right. An abortion is a process that ends a pregnancy either by taking medication, pills, or by having a medical procedure performed by a trained provider, which is a doctor or nurse. So what does it look like as a young person in California trying to access an abortion in the state of California? And Alex, I would love if you could go over a few key pointers for us today.
Absolutely. So everyone in California, but including youth in California, actually have a lot of protections when it comes to accessing abortion. So people in California have the right to access abortion care up to the point of viability, which is around 24 weeks of pregnancy. And this is measured from the first day of someone's last period. And they can't access an abortion or any pregnancy-related service at any age without the consent of anyone else. So they won't need permission from parents, guardians, judges, social workers, no one. And additionally, actually last year, Proposition 1 was passed, and this solidified a Californian's right to an abortion as part of our state constitutional rights. So it's very solid. And just to talk a little bit about like insurance as well. So Medi-Cal does cover abortion services. And for any other insurance, California law is pretty clear that abortion care is basic health care. So most insurance plans are supposed to cover it. There might be some exceptions, but in general, they are supposed to cover it. And I also want to mention that specifically for youth in foster care, they have an additional right, which is to get reproductive health care with a provider of their choice in a timely manner and with assistance for transportation. So since an abortion is a really time-sensitive procedure, this right is extremely important when it comes to abortion care.
Yeah, thank you so much for talking about that, Alex. You know, being a former foster youth myself, transportation and access is very difficult. So, you know, people knowing that this is available to them could be super beneficial. I also wanted to talk about the access part, right? So how are there barriers? You know, I've faced a lot of different barriers in my teen pregnancy. I personally did not have an abortion, but, you know, just researching, like, if I could have one, how could I have one? That was always very stressful for me. I remember, like I said, it was the loneliest time of my life. I'd love, Phillisha, Brandy, if you two could interject and like talk about your experiences, you know, facing barriers.
Oh, totally. I had so many. So with my son, he's my everything. I love him so much. But my choice was taken away from me. I did not find out I was pregnant till about 3 or 4 months. And at that appointment, like they were like, oh, listen to the heartbeat, just like super pressuring. And it like again, I love my son so much, but just my options were taken away from me. What about you, Brandy?
Yeah, I actually I did have an abortion, and the whole just like situation, I felt like I was lucky but also not lucky. I had come back from out of state and I was like, oh, I need to go like refill my NuvaRing prescription. And like they do like the pregnancy test and whatever, like normal. But then she comes back in the room, like the provider, and doesn't have the NuvaRings. And I was like, that's weird. And she was like, did you know that you're 1 week pregnant? And like my initial reaction was like, stop lying. Like, there's no way. Like, but yeah, I was pretty like, I had so many emotions. I was like angry, but also sad because like I've been told that I was infertile up until that point, and I was like, well, obviously I'm not. But yeah, and then I had to decide like, well, I don't know. I decided very quickly. I was like, I want an abortion like right now. But I was like scared because the only thing I knew was like I'm not sure what the different names are. There's like the pill one, the other one. I thought the other one where it's like a surgery basically was the only option. And like I'm scared of getting vaccines. So I was like, oh God, like so I was just like dwelling on like, oh my God, what's gonna happen to me? I didn't feel like pressured, but they did keep asking me over and over and over, like, are you sure? Is nobody's pressuring you to do this? Which made me uncomfortable a little bit. Because literally, like within 30 seconds, I was like, I want abortion. Like, I don't know. I'm like, I feel like it was pretty clear what I wanted. But yeah, but ultimately, like I was going to Planned Parenthood and they were like really informative and really helpful. At first I did try to get the one that wasn't the pill, and it was annoying because they don't do it like in my zip code. I had to drive an hour and a half away. Or I had to have my friend drive me because I was like, I don't want to drive home after this. And then I ended up not getting it because I was too scared. So I ended up doing the pill. And then I don't know, it was just like it was an experience. And then also when I did go to the surgery one and when I got the pill, there was protesters outside, which was a little frustrating because I'm like, oh, we're in California, like why is there protesters? Like it wasn't a lot of them, at least it's only a few. But then my best friend, the one that drove me, it was kind of funny, she like brought a megaphone and she was yelling at them to like make me feel better. So I was like, yeah, screw them, like whatever. And it made me feel less sad. So like I feel like my experience wasn't the worst, but it wasn't, I feel like it could have been a lot better.
Thank you both so much for sharing. Like clearly there's so many different areas that overlap as well, even though we all have a different experience at a different time, from pressure in our communities within healthcare, Brandy, you even mentioned too, like the protesters outside, like that's very emotional. There's so many different aspects, within this topic. And like for me, like I can really relate, Phillisha, to like not knowing your own healthcare, like within, just a young pregnancy and not really sure what choices are going to benefit you and your family. I went through very similar things as well with my son, just from the whole process, and like being in a really religious community was really hard. So I actually ended up, I think people ask all the time, like, oh, like, why'd you keep him at like 15? For me, I'm like, I kind of did it for the plot, to be completely honest. And like for so long, I always felt like I needed like a better reason to give people, you know what I mean? Like it was such a life-altering decision, but truly I never felt like there was anything deeper than that. I just kind of did. I didn't really know what resources were there. I remember calling my doctor being like, hey, like, where do you get an abortion? Because I have Kaiser. So I was like, is it through Kaiser? And they're like, we're kind of like, no, like, why would you ask us that? And I'm like, I remember thinking like, well, I don't know. Like, you're my doctor. Aren't you supposed to tell me this stuff? And, it's very crazy just how there's so many biases, and even I'm not sure if you've experienced this too, and I'm sure it's very helpful, if you're going to have an abortion, like not knowing your genetic history, right? Like for health concerns, right? Like, is it going to be safe? Like all those aspects too. Like I don't know my mom's side at all. So for me, it was really difficult, knowing, in my pregnancy, like why I was having a lot of health issues. So, I think that core is just, that is a very emotional decision, and it's really hard for us as former foster youth and just youth in general to navigate that. And it's a real thing that happens, right? Like all the time.
Yeah, so Brandy, I heard that you were mentioning that you were kind of like considering your two options when it came to like what type of abortion to get. And I like you mentioning that you felt really nervous about the concept of like the surgical one, what that might look like. I hear that all the time from youth out in the community. And I think that to just clarify like what those two options are. So a little bit of background info. So medication abortion, like you were mentioning the pill, this can be acquired typically about up to 11 weeks of pregnancy. And it may or may not involve going into a physical clinic. Actually, since the pandemic, a lot of providers are now offering what's called a telemab. So this is a medication abortion that's prescribed over the phone or over video. So you don't even have to go into an office. Our affiliate actually just started offering telemabs yesterday. So it's an option in California for sure. And if you do end up going in for that medication, usually what they'll have you do is you'll take one pill while you're with the provider, and then 4 pills at home by yourself later. The 4 pills that you take later, actually, you don't like swallow them. They dissolve in your cheek, and they do have a little bit of a metallic taste. So that's sometimes a consideration for people. The first pill stops the supply of progesterone, which basically just stops the pregnancy from growing because progesterone is what is needed to support the pregnancy. And then the second set of pills causes the uterus to like expand and contract, kind of like a period, right? So like expelling all of the contents of the uterus. So experiences with the abortion pill can vary greatly. There might be some discomfort, cramping, and every person's experience is different. So for one person, it might be more intense, and for another person, it might be totally fine. It just depends. And usually a follow-up call or clinic visit is needed to ensure that the process was completed. But your provider would let you know at the time that they prescribe the pill if they're going to need a call or if they're going to need you to come in or if it's fine. For the second type of abortion that you mentioned, it gets called a surgical abortion a lot, but it's actually not a surgery. It's what's called an outpatient procedure. So it's just something that happens in a doctor's office as opposed to a hospital. The other reason we don't call it a surgery is there's no like stitches, there's no cutting, there's nothing happening to the body that might normally happen in a surgery, right? This type of abortion can be acquired about 23 to 24 weeks of pregnancy, so right up to that point of viability that I was mentioning before. And the way that this procedure looks can look a few different ways, but in general, it requires going into a clinic. It might include an ultrasound just to confirm how far along the pregnancy is. You will not be required to view that ultrasound, but you can if you would like to, usually. And they will usually use a tube to go through the cervix, so that's the opening to the uterus, and light suction to clear out the contents of the pregnancy. And again, the level of discomfort can really vary with this. Some providers might offer like a light sedation. And I think if someone's worried about pain and discomfort with the procedure, definitely talk to your provider about pain management ahead of time to make sure that you are comfortable with the plan. And this type of appointment may take a few hours, but the procedure itself only lasts for a short time, maybe 15 minutes. So people might choose which type of abortion they're going to get for different reasons. Some might prefer the medication abortion because they would prefer to go through the experience at home and in private, or maybe they do not want to undergo any type of procedure in a clinic, even if it's, not a surgery, they just don't want any type of procedure. Someone might want to do the procedure though, because, with the medication abortion, it can take a few days to even a couple of weeks for the process to be complete. And so, if someone wants the experience to just be over very quickly, the procedural abortion might be a better option because they can walk in pregnant and walk out not pregnant, right? So there's not any sort of like prolonging of that. Some people also may not have the option to choose the medication abortion as they're too far along in their pregnancy. 11 weeks of pregnancy, people don't often find out that they're pregnant until 5 or 6 weeks, right? Because they don't know until they miss a period, and it's charted from the first day of the last period that they had. So for that reason, the medication abortion is only an option in that first trimester, that early window of pregnancy. And these are just some reasons that someone might choose one or the other. There are honestly many, many reasons that someone might go with one over the other, ranging all the way from transportation issues to not wanting to take pills that might make them nauseous, right? So it really can range. But yeah, that's just the background on kind of the two different types that y'all were talking about.
Thank you, Alex, for sharing, about the different types of abortion. So, Brandy, Phillisha, both of your stories talk so much about like the emotional impact, that having an abortion or having a child really young has on you. For me personally, like I faced so much pressure just from the religious community that I was involved in, and, people in my life having an opinion, and everyone, wants to have an opinion except for you. And no one thinks that you deserve to have an opinion because you're so young, and it's a really rough situation when you don't know what to do with your life and you feel like every choice you're going to make is going to impact, you or someone else, right? When in reality, no one's going to raise your kid for you, or no one's going to go through that emotional, abortion with you. It's going to be you alone. So I think it's really important to understand that it is your right. And for me, I remember the religious community I was in, they took me to a crisis pregnancy center. And I remember like they gave me a blue blanket, which is crazy because I had a boy, but like at the time, it's really like pressure. Like they assumed that I was going to, have my son and all of that. And at the time, I didn't know what I wanted to do. So I think it's really important to know where you're getting care. And I'm happy I have my kid, but it was definitely a bumpy ride and a really bumpy pregnancy and birth. And I was just wondering, like if Phillisha, Brandy, you wanted to talk more about like any pressure you felt from organizations, if you like went to a CPC, or if there's any misinformation that you would like to share.
In terms of feeling pressured, I feel like I'm a hard person to pressure because I'm very stubborn. When I was younger, before I entered care, like my mom was a Jehovah's Witness. So I did briefly think like, wow, she would not be happy with this. But then the other part of me was like, I don't even like her anyways. I don't care. Like, but like when it came to like my own like emotional process, like I still felt horrible. Like I was dating someone for less than a month. I'm like on the asexual spectrum, so I barely have sex anyways. And I was just like, how could this happen? Like, and then the actual like abortion, I mean the pills, I had to do it on my birthday, which sucked. And then I was just scared to tell people, like, even though like me and my friends will be like, yeah, we love women's autonomy and this and that. Like when I actually got one, I was like, oh my God, like what if, I don't know, like I was just making up stuff in my head. Like what if they treat me like my mom would or something? And I was just like freaking out. But then when I did eventually tell my friends, I felt closer to like my girlfriends. One of them got me a balloon too. It said it's a boy, and they like rewrote it and it said it's aborted, and then they brought me like a bunch of tacos. And I thought that was like the funniest thing ever. And that's kind of how I came clean to a bunch of other people. Like I would invite them over and the balloon would be there and they would just be like, so what's up with that? And I'm like, oh yeah, by the way. But yeah, I just found out like through the experience that most of my friends have had an abortion and they were also feeling the same way. Like they were all terrified. But I felt really, really fortunate because like with talking to a bunch of other like of my girlfriends, I found out that they didn't have like the same support system I had. Like their partners were trying to force them to do things a certain way, or their family was. And I was like, oh my gosh, I'm so lucky. Like everyone was like, well, what do you want? And like my partner, they're still my partner right now, but they were like, I told them, I kind of didn't tell them directly. I was like, yeah, I'm not gonna have my period or whatever. And they're like, oh, you can do whatever you want to do. And I was like, yeah, I'm getting an abortion. um So yeah, I'm like, I didn't feel pressured, but I felt like I had a really, really good support system. And like anyone who's listening, I think like the little things, like the silly balloon, I'm like, it really like does a lot. Like it made the experience so much less bad. So just like support your friends.
Humor is always great. Oh my God, that's classic. For me, the pressure was intense. So I did have an abortion when I was 19. I was working to get my three siblings like permanently. Um, and my partner and I like were together for a year. And he like made it very clear he didn't want to get married, have children, or any of that. Like, but he wanted to be with me. So me being young and just needy, looking for love in all the wrong places, I accepted it and I just went with it. And I was happy when I found out because I've always wanted my own. But when I spoke to my partner, he was very like against it. He was like, "You did this on purpose. You know what you're doing." Just kind of like shut me out, and it was really painful. And in that moment, I was like, okay, I just started school. I can't give my child what I would want to give him. And I'm not going to bring it into the same cycle that I was put in. So I ended up having an abortion. When I went to a clinic, they kind of like the pressure of like, are you sure? Is anyone making you do this? And I started crying, and not because he was making me do it, but like emotionally, mentally, he was, right? It's like, I don't want it. That's like, you're on your own if you do this. But it was also my decision, right? And I knew that no, I felt like I couldn't because of the pressure that was being put on me. And then when I got to the clinic, they're like, "Oh, well, do you want to hear the heartbeat before you do it? And you don't have to do this." And because I was crying, maybe they felt like I didn't want to do it too, but I was like, "No, I want to do this. Like, can we just do it?" But they left me in the room for like 10, 20 minutes and then came back like, "Are you sure?" So it was really just like, am I sure? Do I want this? Knowing that what I wanted my whole life is here, but it just didn't seem like the right time. So long story short, I ended up having the abortion. But when I got pregnant with my son, I was like, okay, this one, I'm scared, but no one's taking it from me. So yeah.
Thanks so much for sharing that, Phillisha. Like that's what this whole conversation is all about, right? Understanding like those boundaries through, our experiences. And, Brandy too, like I'm still stuck on the balloon. Like it's true, like having like some like supportive system, right, to help you get through whatever your decision is. It is such a challenging conversation, and it brings up, I feel like every time, I hear other people talk about their story and I share my own, it brings up so many more things, right? And especially like Phillisha talking about like your partner, right, and the family you want to have. For me, like I never wanted kids, I never wanted to get married. Like I was not the young girl who would watch princess movies and be like, oh, like I want a prince one day. Like I was definitely more of like, I can't even think of her name, but the Princess and Brave, who like didn't want to get married. That was really me, truly. And I just, I was really raised that way, I think, through my trauma, to not really rely on other people. So I never wanted kids. And it was different when I got pregnant. I just, it changed my mind, I guess, but I am adamant now about not wanting more. And I think like knowing those boundaries, right, like with the people you're with is a part of it too, right? And like never settling. And I feel like so many people, right, settle with like their bodily autonomy. And Alex, I just wanted, to ask you, like, working with foster youth, and like I'm sure you've heard about, us going to like those CPCs and having people make decisions for us. Do you have like any advice that can help young people make a choice, or help them kind of navigate these circumstances and where to find care?
Absolutely, yeah. So CPC stands for Crisis Pregnancy Center, and these are organizations that usually claim to offer services for pregnant people, but in reality, they're not comprehensive services. So they won't do abortions, they don't do abortion referrals, they usually won't offer birth control either. Some of these are even like not licensed medical clinics that may even provide ultrasounds, even not having a healthcare professional on staff. So it can definitely be very, I think, risky, like going to these types of organizations. In terms of like kind of how to look out for this, I think that in California, just knowing your rights can help you spot these, right? Because as we talked about before, like you don't need anyone else's permission to get an abortion. There are no required waiting periods. There is no requirement that you have to look at the ultrasound. So if an organization is ever asking for these things, if they're saying, oh, you're going to need your parents' permission, or you're going to need to leave for 3 days and come back so that you're sure, that's not required in California. So that's definitely a red flag. You can also do some research on clinics ahead of time by giving them a call or checking their website. And looking to find out, does this facility have a license? If so, what type of license does it have? Does this facility perform abortions, or do they refer people for abortions? And if you're on the phone and you're asking those questions and they don't want to answer those questions, definitely be aware of that clinic, because any licensed reproductive healthcare provider should be able to answer those questions pretty readily.
Thank you for really clearing up those misconceptions. And now that youth listening might have a more clear view on where they can access healthcare, how to make an informed decision. What advice do you have for us to do then,
Yeah, for sure. So, obviously, as y'all have been alluding to, when somebody tests positive on a pregnancy test, it's a really big decision to be made. There's a lot of voices and pressure and considerations. And I think that one thing that I think about a lot is the education that we offer around pregnancy options. So this is actually something we've done as a part of RHEP as well. So offering this session for youth in alternative settings and foster care settings. And this workshop that we do is really structured around like identifying logistics. So, if you're pregnant, what do you have to do beforehand? What are you going to need afterwards? What kind of supplies, do babies need? We're thinking about diapers and food, and it's so expensive, right? What type of support systems does somebody need if they're going to have a child? And we do that for all of the pregnancy options. So parenting, we talk about, what do you have to consider? Abortion, we talk about those options and considerations. We talk about adoption as well as safe surrender. So those are the 4 things someone can do when they become pregnant. And the other way that someone might access this, like let's say, you're not getting a chance to do a pregnancy options education session. Our Planned Parenthood affiliate, and I know that other affiliates offer this as well, do something called options counseling. So this is where you can make an appointment to just talk with someone about these considerations. And the appointment is not for an abortion. It's not gonna be pressured to have someone get an abortion. It really just helps someone look at all of these options and consider those logistics in a really neutral way. And I know that, y'all have talked about how like sometimes doctors can be really vague about things and it can be really confusing. So I think finding options counseling at a Planned Parenthood or another organization that is trusted, that can be a great option for, figuring out what do I do next.
Thank you, Alex, for sharing about all those different resources. Having these trainings and informationals for youth in care is so important. And Brandy, you were mentioning earlier how it was kind of hard for you to share with your friends about your abortion. Like I remember I just like told whoever I could that I was pregnant, and it was really because I was trying to gauge like their responses, to what if they thought that I could like be a parent. And I remember just like I just didn't care. Like I kind of felt the same, like no one could really convince me otherwise. But I was always a very stubborn child and a very angry child. And I remember just kind of seeing how everyone would respond to it. And I thought it was kind of fun, right? Like kind of fun, like even though it was my life, right? Like I shouldn't have made my life into a game, but I feel like just growing up, not really having a family and like having a lot of different people coming in and out of your life all the time, it's really difficult, to kind of put yourself into the highlight, the spotlight, or was for me at least. And Brandy, Phillisha, I'm not sure if either of you like had similar different experiences with, the emotions you both faced. But I'd love if you could share on that.
I literally hid my belly until I couldn't hide it anymore. And I went to work one day and they're like, "Are you pregnant?" Like, and I'm like, "Oh yeah, They're like, "Oh my God, you weren't gonna say anything." Like, it was so many emotions that I was crying all the time. And then I just realized like it's okay that I'm crying. Like, thankfully I had my mentor to just like constantly remind me, like, it's okay. It's normal. It's your normal, right? Like, what is normal? You make your own normal. So yeah.
Ever since I got pregnant and had an abortion, like my emotions have just been so, I don't even know where they're at. Like the day I found out, like obviously I went in, like I said earlier, and I didn't expect to be pregnant. I was like, oh, I'm gonna get more Nuva rings. And after they told me, I was going to Pride in San Diego, and I just kept crying like randomly because I'm like, oh my God, I have to get an abortion. Like my mind was just fixated on like, I'm gonna have to get an abortion. And I was like so anxious about it. And just like, honestly, I feel like I was overreacting a little bit because like, I'm like, I don't know what an abortion is like. So I was just inventing things in my head when I could have easily just like asked Planned Parenthood or Googled it or something. But I was like, no, I'm so anxious and sad. Um, and like, I can't even imagine the emotions I would have been going through if I didn't have a good support system and if like the people that I was interacting with at Planned Parenthood like weren't good people. I'm like, I cannot imagine having have felt worse. So I feel like it just affected me like forever because now I'm just like on the edge. I'm like, any little thing, I'm like, I'm pregnant, and then I'm like, let me go take a pregnancy test. Like, um, but yeah, but I'm like, I can't even imagine like people going full term with pregnancy. I'm like, I can't handle that many emotions. Like, I found out I was pregnant after a week and I got the abortion within a month. And I'm like, that's all the emotions I had from a month. I can't do 9 months of more emotion.
I actually love that you shared that it still affects you because even though I came to terms with my first abortion, like I still think about it. I look at my son now and I'm like, wow, what would my other baby be like, And sometimes I feel bad about like having it because I didn't really make that decision. I kind of just went off the energy I was given. But it's so good that like yourself to be like, I can't handle this or I can't. And you also mentioned like you didn't know, and that you were probably overthinking, like you were not, you were doing the thinking that you needed to do, like, and you didn't know, so it can't be overthinking, right?
Yeah, thank you both so much for sharing. Like obviously it's a hard conversation, but I feel like, everyone here has worked through it and, there might be listeners who haven't yet like gone through that, or they might, have this experience, a couple months, couple years. So it's so important to, talk about like the during, the after. And I just wanted to close out, like, Alex, if you could talk about like different resources, for accessing an abortion, accessing education, if there's anything for like those mental health resources that I was mentioning, that'd be really amazing just to help listeners and youth know how to care for themselves.
Yeah, so y'all talking about the sort of like after an abortion, people sometimes need support. There are two really great resources, one called Exhale Pro Voice and one called Connect and Breathe. And all the links will be in the show notes. But those are both non-judgmental talk and support lines for after someone has an abortion. Because like y'all are saying, huge range of emotions, and some people do need help processing, even if it's what they wanted. And even if they knew immediately it's what they wanted, sometimes they still, it's helpful to have that support. In terms of acquiring an abortion, so PlannedParenthood.org is always a good place to start. You can put in your zip code. It'll help identify what is near you, what services they have to offer. And like I said, a lot of us are offering telehealth abortions if you're using the abortion pill now. So you might not even have to go into a health center. If you are having any troubles acquiring an abortion from Planned Parenthood, or maybe you aren't able to cover it with the insurance that you have, there's another great resource called abortionfinder.org. This can help you identify your options and even locate abortion funds. So if you need money to help pay for it, there's funding that can be found there. And additionally, I really recommend checking out teenhealthrights.org. This is a legal guide to sex, pregnancy, and parenting. So just a lot of information that can help you make sure you're not getting taken advantage of, you're not getting pressured in ways you don't want to, and you know what your rights are. And lastly, I have to plug that my organization has a great group of youth called the Peer Advocates, who actually created a Teens Guide to Abortions last year for teens in the state of California. And they also created a version with information for adults. So if you are an adult, a supporter, a staff member, somebody who's supporting youth in these situations, there'll be a link to that as well of what you can keep in mind. But that was made by youth for youth. So I think it's always a great thing that kind of encompasses everything and talks about abortion from a youth perspective.
Thank you, Alex, for sharing about the different resources that are out there. It's helpful for me if I ever land in another situation. So I think it's going to be very helpful for all listeners and youth in the audience. Thank you so much, Phillisha and Brandy, for speaking on your experiences with me. It was really great. I feel like having all of our unique perspectives, and we all went through something totally different. So I feel like it kind of was like forgive me for saying this, but like a tastemaker of choices. So thank you all for being here today, and looking forward to speaking with you all again.
Thank you. You all were awesome.
Thanks for stopping by. To hear more and support our cause, like this video and subscribe to our channel, and check out fosterreprohealth.org for more resources.